evening, everyone. It's my pleasure to welcome you to a very special evening for both the School of Medicine and School of Nursing. Frankly, this is always one of my favorite evenings in the academic year. Tonight, we'll be honoring our 2020 and 2021 Distinguished Emeriti Faculty Honorees. Our team has worked hard to organize tonight's event, and I think you'll agree that we've put together a program that will translate well into our virtual format. This event is live and will be recorded, so please read the chat comments for Zoom housekeeping notes. Whether we come together virtually or in person, is always an honor to pay tribute to our newest class of Emeriti faculty. The 2020 and 2021 classes, like the classes before them, represent the very best of Duke. Our honorees have excelled in their fields. They've made significant contributions to research, education, and patient care, and they've had a positive impact on individuals, families, and communities. Some of tonight's honorees have spent their entire careers at Duke, while others have brought their expertise and wisdom to us after notable careers at other institutions. Regardless of when or how they found their way to Durham, each of them, in their unique way, has made their mark at Duke through the patients they've served, with the colleagues they've worked alongside, and on our future physicians and researchers that they have taught and mentored. It's an honor to be here celebrating these accomplished individuals. As Dean, it's particularly meaningful for me to have a chance to express my admiration and gratitude for the faculty being honored this evening. At this time, I'm pleased to welcome my co-host, Marion Broom, Dean of the School of Nursing.
Hello and good evening. It's truly a pleasure to be here with everyone for this wonderful celebration. I would like to welcome all the department chairs and other guests who are here tonight. Also here this evening are current Emeriti faculty members. You are an important part of Duke Health's past, present, and future. And our institution is immeasurably stronger because of your many contributions and continued involvement and investment in Duke. We thank you. Tonight, we will continue our tradition of recognizing the honorees who are present, but we will do things just a little bit differently from our past celebrations. We will show 3 videos. The first honors 4 of our honorees from the classes of 2020 and 2021. The second features 3 honorees from the Department of Pediatrics, and the third features 4 honorees from the Department of Medicine. The honorees were kind enough to let us film them, some via Zoom no less, in an attempt to represent the scope of their inspiring careers and outside interests in a mere 2 to 3 minutes. Tonight, we are pleased to have 12 of our 22 honorees present. Our first video features the following honorees from the classes of 2020 and 2021. Rochelle Schwartz-Bloom, Professor Emerita of Pharmacology and Cancer Biology. Mark Dewhurst, Gustavo Montana, Professor Emeritus of Radiation Oncology. Salatorio Martinez, Professor Emeritus of Radiology. And Susan Schneider, Associate Professor Emerita in the School of Nursing. Now let's watch all together our first video featuring these distinguished honorees.
You mean I could have a career studying the brain and how drugs affect the brain? Oh, that sounds really cool. As a graduate student, we found the receptors in the brain that respond to nicotine when the organism, animal or human, is exposed to nicotine over time. The nicotine receptors increase their number. And we proposed that in 1982 in Science, that was a cellular basis for addiction to nicotine. I went to the National Institute of Mental Health right after I graduated with my PhD. And I got involved in another receptor in the brain that is very important in anxiety, stress, and even epilepsy. And that is called the GABA receptor. I was fortunate to discover a method, a technique for studying how that receptor works. I came to Duke in 1986. I really liked the faculty at Duke. I'm most proud of accomplishing 2 things at Duke. So one is related to my bench science research, and that was involved the ability to understand how to protect the brain from damage after a heart attack or stroke. Also my science education research. I was able to show nationally that helping kids learn basic biology and chemistry in the context of pharmacology, all about drugs and alcohol, helps them learn their science better. RISE stands for Raising Interest in Science Education. I develop courses in research, independent study, and science education. People from all over the world have used our resources in our programs. I established the Duke Center for Science Education in the early 2000s. I knew that there were other people at Duke where faculty as well as students were also involved in science education. And there was no way for any of us to talk to each other. Of all the awards that I've won, this one is most special to me. It is the induction into the American Association for the Advancement of Science. I've always been athletic. I've gotten involved in triathlons. I have been to world championships probably about 12 times. I love the challenge. I love the camaraderie. My husband, Paul Bloom, is now teaching in social entrepreneurship as his retirement activity, and also he's the coach of the Duke Triathlon Club. It's probably the best thing, of course, that I've ever done was being here. It's really allowed me to use my creativity in a number of ways, both from my bench science research, and I have to say the same thing about the science education. It's a very different approach to using my pharmacology background.
Both of my sets of grandparents were farmers from Kansas. So as a kid, I spent a lot of time out on the farm. I chose veterinary medicine because I was interested in studying diseases. I wanted to work with dogs with cancer as models for humans. The canine cancer population is very, very similar to humans in many ways, and the typical biology of various cancers in dogs mirror what happens in humans. It just happens faster. The main things that we learned, which did have an impact on human trials, was the importance of how you measure temperature, also various factors that could enter into how the tumors will respond to the combination of heat and radiation. So in 1983, the Staten Island Zoo contacted me about treating a tortoise that had a cancer of the axilla with radiation therapy. The tortoise's name was Jalopy. They shipped the tortoise out to Tucson, which is where I was working at the University of Arizona, and we proceeded to treat it with radiation therapy. Here's a picture of him. Actually, that's good. This is tape, and he had a furniture dolly taped to the bottom of his shell so he could get around because this arm didn't work. That's why he was called Jalopy. After that, I got calls from zoos all over the world wanting me to treat their various, exotic animals. But I didn't do any more after that. In the last 10 years of my career, I was an associate dean of faculty mentoring. There were really two main goals in that. One was to try to help young faculty be more competitive in the grant market. And the second was to develop a mentor training program. By the time it was done, we were doubling the national average for grant recipients. What I'm most proud of during my time at Duke is the legacy of people that I trained here and the fact that many of them have gone on to have great success on their own. These are mentoring awards that I received over the years. There's one from the Cancer Center here. These are from various institutions. My wife's name is Nancy and our son's name is Larry. My wife and I travel quite a bit. We go to Hawaii almost every year. The first time she took me over there, I thought, it can't be that good. But it is. Duke, for me, was a very nurturing environment. I had a series of just outstanding chairs of radiation oncology that were extremely supportive, and I couldn't think of a better series of chairs than the ones I had.
As a child, I was impressed by two local physicians. I also had an exposure from a radiologist who was the uncle of my lifetime classmate, who had one of the largest private radiology practices in Havana. As a physician, I was not allowed to leave the country. So I decided to go and work in the private office that I mentioned before. After several years working in that offices, they came at some point, the communists had confiscated. I contacted one of the authorities in public health again, trying to obtain permission to leave the country. And then he said, if you work in a hospital for a year, we may be able to let you go. After 7 years, I was finally allowed to leave with permission from the Castro regime. Cuba did not have diplomatic relations with the United States. So I left through Spain, and from there came to the United States and did 1 year internship in Ohio and applied to 10 different universities for training in radiology. And the first one to accept me was Duke. I arrived at Duke in 1968. I completed my residency in radiology and have spent the rest of my life learning, teaching, and doing research. Having a passion for my work and coming from Cuba, I wanted to give back my experience to the Spanish countries. I decided I needed to help others who lacked opportunity in their countries. The idea was that they could have a multiplying effect of their skills and transfer it to their countries of origin, providing a legacy from Duke to the Hispanic world. The chair of radiology referred to me as the ambassador to the world of Duke radiology. I had a privilege of working as a chief of the musculoskeletal section, Department of Radiology, for 2 years. Upon my retirement from PDC, the Department of Radiology at Duke created the Salutario Martinez Scholarship to continue my legacy toward Hispanic professionals and communities. Duke has been my home, my family, during the longest part of my life. Duke has allowed me to grow through learning, teaching, and creating new meanings in the field of musculoskeletal radiology.
I always knew that I liked sciences and math, and I wanted to do a profession that helped people. And when I was 17, I had a very serious illness and spent 4 weeks in the hospital. And that's a perfect time for a 17-year-old to interview everybody at the hospital and see what's going on. And so I talked to respiratory therapists and doctors and just about everybody, but I realized it was the nurses that helped me through this experience. I was recruited to Duke by Dean Mary Champagne, and at the time there were only 25 faculty in the School of Nursing. And since then our School of Nursing has grown to over 90 faculty and new buildings and increased research and rankings nationally, and it's been very fun to be at Duke throughout that process. I've been inspired by students, and I mentored over 200 oncology advanced practice nurses and had the chance to develop oncology nursing programs both nationally and globally. Through Duke, I was able to go to Taiwan to help set up a nurse practitioner program there. And through the Oncology Nursing Society, I have developed leadership programs throughout the world, and I have given talks in China and the Netherlands. And so the chance to develop oncology nurses of the future has been very, very rewarding. I also have been very proud of my program of research in which I've conducted symptom management research that helps people to tolerate and adhere to treatments for cancer. We know that those can be very tough, and it can be a very stressful time for people to have that experience. I was one of the early researchers who used virtual reality as a distraction intervention to help people tolerate chemotherapy. And we showed that by putting a virtual reality headset on someone during a chemotherapy treatment and distracting them from the stresses of the treatment room helped to mitigate their symptoms, helped the time to go faster, and definitely made the treatments more tolerable. I was appointed to the Biden Cancer Initiative following the Obama-Biden administration, where they had the follow-up to the cancer moonshot, and I was the only nurse on that board. So those are my chances to do some advocacy work that I've been very, very proud of. I look at it still as a wonderful opportunity. I'm proud to be an Emerita professor and have been really proud of my connections with Duke.
What a wonderful video. At this time, we are now going to enable the chat function for those of you who would like to share any words of acknowledgement and appreciation for these honorees. While everyone is writing their notes and of congratulations, we would like all the honorees, Dr. Rochelle Schwartz-Bloom, Mark Dewhurst, Solatorio Martinez, Susan Schnox, if you have them with you. We know that some of you are traveling. Please pause so we can take a picture and so we may celebrate and offer our sincere gratitude to you for all you have done to enrich the lives of so many at Duke over the years. Everyone can now also unmute your microphones and applaud. Honorees, please pause so our technical producer can take a picture.
Everyone, and good evening. My name is Ann Reed. I'm the chair of the Department of Pediatrics, and I'm truly honored to be here tonight celebrating and recognizing all of the outstanding faculty members. I'm especially honored to pay tribute to the honorees from the Department of Pediatrics. Here with us tonight are Dr. Dennis Clements, Professor Emeritus of Pediatrics, Daryl Lewis, Professor Emeritus of Pediatrics, and Phil Rosoff, Professor Emeritus of Pediatrics. Thank you all so very much for what you've done and continue to do for Duke and the Department of Pediatrics over all these years. Now let's watch the video featuring these distinguished emeritus faculty honorees.
One of the things that has been exceptionally good about the time that I spent at Duke was the opportunities it afforded me to explore different ways that I could do doctoring. My primary clinical interest has been, for the past 40 years, has been pediatric oncology, and I was able to do that, I think, quite well at Duke. I came to Duke in 1995 with an entirely different job than I ended up having. I came as a chief of the division of pediatric hematology oncology and did that for 9 years. I was able to explore other ways to professionally advance myself, and that's how I merged into my other main activity that I spent the rest of my time doing at Duke, which is in clinical medical ethics at Duke. I was privileged to be able to care for a large number of patients who I either treated primarily myself or were transferred in, or my colleagues had treated as young children, and I saw them for years. And there were some patients when I retired in 2019 that I had been seeing for pretty much the whole time that I've been there. So they started off as young kids, and then they started bringing their kids in. I have been extraordinarily impressed about the quality of the people who work at Duke, and how generally generous and collegial and collaborative so many people are here.
My strength was in science and math, so I said people, science, and math. It sounds like medicine. I came to Duke in 1973 as a resident. I spent 3 years here. Then I went into the Air Force. We flew the Pacific, which was fun. A few changes.
A little bit, but not much.
I've been at Duke 47 years now. Here I am on one of my better days after coffee. The thing I'm most proud of at Duke as part of my legacy is that our primary care group went from very small to being a full-fledged we take care of children clinic. I became a primary care pediatrician and started the Duke vaccine unit, looking at vaccines for children. These are what I've retained from going to meetings all over the world as part of my vaccine research. Until 2006, I was in various positions in the pediatric department. I was interim chair for a while. Then Duke Global Health Institute started, and I became the senior advisor, and I started spending about half of my time at the Global Health Institute. I was the division chief for primary care pediatrics. Over 23 years, we grew from 7 people to about 40, and 1 location to 3. Since the year 2000, I've been going to Honduras with an interdisciplinary team. We were able to build a clinic, and they now have a nurse there all the time, and sometimes a physician and sometimes a dentist. So there was quite a transformation. Of all the awards I've won, the one that means the most to me is one I received from my students after a Honduras trip. When we first started, the latrines were holes in the ground. So at the end of one of the trips, they gave me this, and they signed it. I'm a mentor to a lot of students. It's fabulous. I call them undifferentiated stem cells. They can do anything. They're really excited about everything. We bought an airplane as a resident here at Duke. The Earth looks really beautiful from the sky. I've just always been fascinated by it. I'm married to Martha Ann Keel. She's a pediatric dentist. I have 3 daughters. They're all in San Francisco, and we have 7 grandchildren. Duke honestly has provided me the opportunity to sort of expand my horizon and do things that I think in a lot of other places you just wouldn't have the opportunity to do.
I realize that one of the biggest puzzles we have in science these days is the brain and consciousness. And at the same time, I wanted to be a doctor. And I was torn between public health and neuroscience. Eventually, I just decided on neuroscience, and that's how it happened, through an interest in the brain, basically. Well, when I was at the National Institutes of Health, I had some collegial relationships with researchers at Duke. They were doing similar research to what I was doing at the NIH, and so I thought it would be a good place to combine my residency training and still be able to maintain my National Institutes of Health research path. My favorite period at Duke was when I was able to run a lab, have some very bright postdocs come through, and at the same time, I was able to maintain my work in the division. I think I served as a division chief during part of that time. I was extremely busy, but I think that was my favorite time because I could whip over to the lab and get something done in terms of neuroscience and neurophysiology, and then I could rush back to clinic and get some stuff done there. And the grants were being funded, and it was just a fine time. I think I'm most proud of the wonderful trainees that we turned out in our division. We had some fantastic residents, and I think they certainly enhanced our ability to take care of kids and advance pediatric neurology. So Duke really helped me in my search for funding and in my research. And because it's a good place, it attracts so many good people that you've got all of these colleagues and all of these people working with you who also, push you ahead. And the good people and the good reputation of Duke, I think, is something that was crucial to my career.
Videos, but even more inspiring are your personal stories, which I just love hearing. At this time, we've opened the chat function again for those who'd like to contribute any words of acknowledgement, appreciation for the honorees. And while everyone's writing their notes, we'd like these honorees, Dennis Clemens, Darrell Lewis, and Philip Rossoff, to have their engraved clocks ready. Our technical producer will spotlight you holding up your clocks, and just pause so we can take a picture and celebrate and offer our sincere gratitude, and everybody then can unmute and applaud. Now we can applaud. Okay, Kathy.
Hi, everyone. I'm Kathy Cooney. I'm chair of the Department of Medicine. I'm really honored to be here tonight, celebrating and recognizing some really, truly outstanding faculty members. And I'm also honored to pay tribute to these honorees tonight. And these are the following individuals: Nancy Allen, Professor Emerita of Medicine; Joseph Moore, Professor Emeritus of Medicine; Douglas Schocken, Professor Emeritus of Medicine; and Daniel Sexton, Professor Emeritus of Medicine. Thank you, all of you, for everything you have done and continue to do for Duke University and the Department of Medicine over the years. Now, let's watch a video featuring these distinguished Emeriti faculty honorees.
I started on my career path probably when I finished high school. I grew up in Richmond, Virginia, wonderful parents, 2 sisters, went to public school, and the summer I finished high school, I got a Richmond Area Heart Association grant and worked in a lab at the McGuire VA hospital there. So that was probably my first real exposure, since I had no one in the family in medicine. I joined the faculty in my 4th postgraduate year at Duke, and actually was hired on the faculty on April Fool's Day of 1982. It was supposed to be a temporary position, but I served as faculty for 38 years. Dr. Joseph Greenfield became department chair the year after I started, and he was a great advocate and supporter. So I spent a lot of my career in advocacy for women and for all kinds of policies to make Duke a better place. I also spent many years traveling to outreach clinics, first in Henderson and then in Fayetteville, and then for 26 years in Roxborough at Person Memorial Hospital, and I took fellows with me there. I loved every aspect of clinical education, research in vasculitis particularly. And I started in that career field because Bart Haynes, who's now head of the Duke Vaccine Institute, had just come from the NIH, where he worked in the vasculitis unit headed by none other than Dr. Tony Fauci. So Dr. Fauci was a big researcher in the field of vasculitis, blood vessel inflammatory diseases, before HIV in the early 80s, when he shifted his research focus. But Dr. Haynes took me under his wing, and he was starting his lab, and with patients still being referred to him, he needed someone clinically to take care of them, so I became that person. And it really was a serendipitous and lovely way to have a field of specialty within my subspecialty of rheumatology. My overall feelings about Duke are basically gratitude for matching in the internship,
and gratitude for being offered a fellowship and a temporary faculty position that led to 38 years on the faculty.
I first came in contact with physicians as a young child and as a young adult. I grew up in a small town in Georgia, and all of the physicians that I came in contact with were general practitioners. And they had several really fantastic qualities. One is they were nice people, they were good people, they were well respected in the community, and they knew when they were over their heads. So they were really good doctors and they had that kind of skill. And I think that impressed me, and I wanted to be like them. I came to Duke as a fellow in hematology and oncology, and I arrived here on July 1st of 1975. With the intent of being here for 2 years and then being elsewhere or doing something different. And little did I know that 2 years would turn into now almost 46. And it was a great place in my evolution as a physician. And so again, I think it was a little bit of a natural, but I was fortunate that my superiors allowed me to stay. Some of my colleagues now were my students back then, and that's a fantastic evolution. And I think that other things were teaching at every level. I've taught at house staff and medical professions, high school students, undergraduates from Duke, and always loved the teaching, particularly in my clinic and at the bedside. So that's very much in the Oslerian tradition and something I enjoyed very much. I'm proud of the Distinguished Faculty Member Award by some 10 years ago almost now, by the Medical Alumni Association, the Wayne Rundles Award for basically for research, and then the Wendell Ross Award for teaching, among others. I was named a master clinician almost as I was completing my, and I also won the Leonard Toe Award for humanity. So I feel like those are all extremely important to me. I'm honored to have been part of that growth. And when I first came here, we would all gather in workrooms, and at the end of a year or two, you knew everybody on staff. And now with the growth of staff and just the physical, buildings, which are also part of that fantastic growth, I'm proud of all of that very much.
It's a real honor for me to share the dais today with so many distinguished colleagues and friends from my career. My first association with Duke came from the early 1960s when my science teacher in high school introduced me both to biology and to Duke University. And the road has been quite a journey since that time. I took all my training at Duke, from undergraduate through medical school, internal medicine training, and cardiology training. And I was truly blessed to be asked in 2008 to return as a senior faculty member in the Division of Cardiology. In terms of favorite memories, I'm a Duke Blue Devil. It's very easy for me to pick one out. Duke 87, UNC 86, as the unranked Duke Blue Devils defeated the Carolina Tar Heels in 3 overtimes, 1968. What a wonderful memory. In terms of important people that I worked with, there have been many. I think at the top of the list, though, of people I should recognize, my parents, who started me out on my career and were very supportive all throughout their lifetimes. And my family, my wife in particular, and my kids, who put up with me for years and years, and through my past 13 years on campus back at Duke. I'd also like to acknowledge a number of individuals who had helped me along the journey, and I've worked with many of them from Duke, including from Terry Sanford through Bob Lefkowitz and lots in between. My two favorites, though, were Wallace Fowley, my French professor as an undergraduate, and I owe a lot to Bill Yarger. I was the first medical student to work in his lab when he was a young faculty member, and Bill taught me a lot about science. I also want to acknowledge the impressions that I've had about this place. When I came here in 1966, this was a very good regional university. But as I retire, I'm retiring from an absolutely elite and extraordinary institution that has an influence around the world on essentially a daily basis. It's been quite a ride, and I'm extremely grateful for the opportunity that I've had that's been given to me by Duke University and many, many, many people here. Thank you so much, and my best wishes to everyone else on the program today.
I was really thinking about being a cardiologist, but during my internship in New York at Mount Sinai Hospital, I got drafted into the U.S. Army. And through good fortune, I was able to secure a position at the Centers for Disease Control after my internship to take care of my military duty. And that introduced me to the world of infectious diseases. And as soon as I saw that world, that's what I wanted to do. My reason for going back to Duke was I wanted to do research. And by good fortune and luck, I was placed in an office next to Eugene Stead, who was the former chair of medicine at Duke. And he suggested, and I finally realized he was right, that I should be doing my research in the community setting, even though I was in an academic center. So I became, because of my background in hospital epidemiology and my experiences when I was in private practice, I became the hospital epidemiologist at Duke. And then I sort of gradually shifted over 20 years. My clinical career moved into more of a research career. So I kind of ended up doing what I wanted to do, but it was about a 15-year period in between where I was doing almost all clinical medicine. The two areas where my happiest memories are, gradually, as I started teaching more with residents, first in medicine and then later in infectious disease fellows, the happy times I had were with those people who sort of, in a sense, became sort of like my children. I knew them well enough. We spent a lot of time together. I knew about their lives, their families, their aspirations, So that would be probably the happiest memories I had. And then in 1997, we started the network of community hospitals to provide services for epidemiology and hospital infection control. From 1997 to 2020, I was director of that network, and it grew to 62 hospitals in 7 states. And I became quite familiar, or very familiar, with the people who worked in those hospitals. I guess I'm most proud of the fact that I was able to establish a program in hospital epidemiology, which is the biggest program in the United States. The environment is just a physical place, but the people in that environment is what's impressive. And Duke has been really, really successful at getting very ambitious people who want to run fast in a pack and learn. And so I think that the growth of Duke has just been astonishing.
What a wonderful video. I always love hearing these stories. At this time, we've opened the chat function again for those of you who'd like to share words of acknowledgement and appreciation for the honorees. And while everyone is writing their notes, we'd like all 3 honorees, all 4, not honorees, Doctors Nancy Allen, Joseph Moore, Douglas Shockton, and Daniel Sexton to have their engraved clocks ready. Our technical producers will spotlight all of you together, holding up your clocks if you have them with you. If not, just smile.
Close for the evening. I'd like to acknowledge the Emeriti honorees who couldn't be with us tonight. Ralph Corey, Professor Emeritus of Medicine, Gary Hock Distinguished Professor in Global Health. Elizabeth DeLong, Professor Emerita of Biostatistics and Bioinformatics. James Les Harmon, Associate Professor Emeritus in the School of Nursing. Eugene Adoni, Professor Emeritus of Medicine. Catherine Pereira, Clinical Professor Emerita in the School of Nursing. Claude Pianadosi, Professor Emeritus of Medicine. Robert Shipley, Associate Professor Emeritus of Psychiatry and Behavioral Sciences. Nancy Short, Associate Professor Emerita in the School of Nursing. Charles Vacchiano, Professor Emeritus in the School of Nursing. And David Witzel, Professor Emeritus of Surgery. And I also want to say that I have had the honor of working with so many of you and being inspired by you. Thank you.
Thank you, Mary.
Hello. Is this a time to say something? This is Ted Treble. Can you hear me?
Sure, go ahead.
Oh, great. Well, I'm a patient, and I haven't heard anything about patients from all these wonderful people, but I'll speak for all of them to say we're blessed to have had everyone. But I had a particular one here of Dr. Doug Shocken, and it's a small world, so I'll share this with you. His mother and my mother had recipes in the World War II submarine spouse cookbook. And it was something that we shared our submarine background, and it was a blessing for me to have Dr. Doug, as I call him, and it was really interesting to hear what everyone had to say here. But so next time you ought to have a couple patients on there to say, hey, we love all you guys and we appreciate what you did. Thank you.
I think that is a great idea. And thank you for bringing up, Ted.
Thank you, Ted.
Wonderful idea. It is difficult to overstate the legacy of excellence represented by all these Emeriti faculty honored tonight and every year at Duke University Medical Center and in the schools of medicine and nursing over the past decades. Once more, we thank all of you, especially that last contribution, for your contributions to your patients, your students, your colleagues, and to all of those who continue to benefit from your good work. A copy of the videos will be stored in the Duke Medical Center archives for posterity.